I had another patient today who I've treated, trigger finger, ultrasound guided, pinhole technique, wound healed in 3 days, but she's still quite sore and she's 6 weeks down the line. And it's really difficult to judge that actually that's enough time now, it should be better, should we do something about it? But a lot of the time, the thing that I wanted to get across on this video is that it can take a long time for things to get better. Inflammation, which is the majority of the reason that your brain is interpreting it as pain. So that's inflammation, which is the majority of the patients that come in and see me have inflammation somewhere. And that inflammation takes a long time to settle because we can't stop using our hands. We use our hands for everything. We hold a pen, we grip things, we do all that sort of thing using our fingers and using our hands. So we never really give them a rest. So inflammation can take a long time. So if you're struggling after an intervention or using a splint or you've had an injection or even after surgery, don't worry. Time is a much better doctor than me. Time is a much better doctor than any of us in the medical profession because time will cure, time will heal, and you just need to listen to your body, be kind to yourself, be gentle, and don't screw it up because your body is telling you to stop. You know, if you have pain, that is your body's way of telling you to stop. So please, 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 please listen to it. And go from there. The vast, vast, vast majority, 99% of the time, if you have pain, it is your body's way of telling you to stop and you shouldn't go through it. So if you do go through it without knowing what the pain is and where the pain is coming from, then you may well make it worse. And that makes my job worse and harder as well. So if you do think that you might need to ever get something treated, probably worth getting an advice sooner rather than later, so that at least you have the correct diagnosis and then you can not worry about it. But if you don't know what the diagnosis is, then please don't crack on. You're just doing yourself some harm. Okay, come and see me.